Hey everyone, I'm Hannah McCollum. I'm doing my demonstration speech today on how to start an IV. This is Judd Morgan. He's going to be my patient today. I have a large audience today kind of watching, so I can teach them kind of the steps of how to start an IV, the supplies you need, and how to actually insert the IV. So we'll get started now. So the first step we're going to talk about is, gathering the supplies. With an IV, you need numerous things. First thing you're going to need is your IV start kit, and we'll go over that, what's in it when we start the IV. The next thing you're going to need is a flush. You need to be able to flush your INT before you start it. Second thing is going to be your INT. This is what you hook up to the IV once you get started. This is just kind of gives the blood. You can pull your blood from it and flush the IV with this also. The next step is going to be selecting the perfect needle. As I was talking about earlier, IVs can be started many different ways. The 20 gauge is usually what we start on most of our patients here in the ER. The second option is an 18 gauge. 18 gauge needles are usually started on our trauma patients, anybody who has internal bleeding that might need blood transfusions, large IV gauge needles for lots of fluid or anything like that. The second one is going to be a 22 gauge. We usually use these on babies or anybody who has small fragile veins. So that's kind of a rough idea of kind of what all you need to start an IV. So the next thing we're going to do is first talk about how to select the perfect vein. When you think about IVs, you want to have a vein that's very big and juicy. So I picked Judd as my candidate because he has pretty good veins. So we'll start with this. Okay, so just opening the kit, I'll let you kind of see what's in it, so you'll kind of know. You're going to get a tourniquet. This is just to help with the pull the blood up, alcohol prep, tape, and a op site. Okay, so the first thing you're going to do, of course, you're going to wash your hands. Make sure your hands are clean. Next thing, you're going to get all your supplies ready. First thing is you want to make sure you always prime your INT, make sure there's no air in it. You don't want air going into the patient's veins. So you just hook it up to here, and then just flush it until you see it come out the side. Alright, so the next step that we talked about is finding the perfect vein. So we're going to put the tourniquet. Usually you want to go for the AC veins because they're bigger veins and usually a lot easier to see and find. So on here you just want to put it real tight. Alright, so you're going to look. As you can see on Judd, you can see a pretty big vein right here. Those are usually, like I said, the best veins to go for. So what we're going to do first is we're going to make sure we clean it really good. Here you want to do about 30 seconds and do vigorous back and forth motions to prevent any bacteria to the side or anything like that. Next, you're going to make sure we have all of our supplies in hand and ready. You're going to apply some gloves. You can go ahead and tear your tape. You'll have it ready for you when it's time to do your IV. Like Judd's doing it now, if you tell him to make a fist, it makes it easier for the veins to pop up. So the next thing is going to be selecting your needle. With Judd, since he's not a trauma patient and he's just a regular patient, I'm going to put a 22 with him, so it's a smaller size needle. Alright, so before I even insert it, what I'm going to try and talk about is when you insert it, it's kind of a fast process. So what you're going to do is you're going to go ahead and stick it into the vein. You push it in a little bit, you'll see blood come back in this white chamber right here. Once you see the blood come in here, you're going to hold the needle and advance the catheter in all the way in. And then the needle will come out, of course. So if you want to zoom in and kind of looking to see what's going to happen, this is real small. You just tell a patient, big stick, kind of hold the skin real tight and go 1, 2, 3. You're going to insert. 22, so you might not see too much blood, but once you see the blood, you just insert like here, hold pressure on it. You can hook your INT up to it. Being that it's a small gauge needle, like I said, these are usually used for babies, so you might not see too much blood coming through. You always want to pop your tourniquet this way that the vein won't blow whenever you flush it. Just flush it right here. It's going to go in. Once it's in, you just put your 2x2 on it. always clamp because you don't want air or anything to go into it. Take the tape off of it. Then you can just tape it up. And like I said earlier, with an IV, it's used for medications, fluids, blood, anything like that. So I'll just do a quick example really fast on how to take it out also. It's just real simple. Of course, take the tape off. Make sure you hold the IV in place. Removing it's really simple. Just apply pressure to it, hold it right here and pull out, and then you're all done. Put tape on it. Tell the patient usually to hold pressure on it for a good 15 to 20 seconds just so that it doesn't bleed. Once that's finished, the patient will be good to go and have fluids and blood and anything else that he needs. So that's all. Just make sure you show it.